Reproductive embryology, the pharyngeal apparatus. All right. I'm sure you guys remember learning about the pharyngeal apparatus when we were M1s. This is like horrible. I hated the pharyngeal apparatus so much, but I'm going to make it very clear and straightforward to you guys. So hopefully you will take away the only things that you really need to know for the exam. That's it. So we separate the pharyngeal apparatus into clefts, arches, and pouches, okay? Specifically, I'm going to start off with the clefts. All right, so we have pharyngeal cleft derivatives. Now, the most important thing is that, first off, clefts are also known as grooves. So don't get confused. They're going to be so annoying about this, but if you see pharyngeal cleft or pharyngeal groove, they're talking about the same thing. All right? Now, the only thing you care about for the pharyngeal cleft derivative is known as pharyngeal cleft cyst. This is a pathology that is a persistent cervical sinus. And we already talked about this earlier, but once again, it presents as a lateral neck mass anterior to the sternocleidomastoid muscle. They always say the sternocleidomastoid is involved, okay? And it does not move upon swallowing. They could say it's a fluctuant mass, but that does not mean that it's moving during swallowing. So they could try to throw you off, all right? But the most important thing to know is that it is anterior to the sternocleidomastoid muscle, so it's usually involving the sternocleidomastoid, and it's a persistent cervical sinus that presents as a lateral neck mass in children. And the reason that it occurs is because it's incomplete obliteration of a pharyngeal cleft or groove. So they can ask you, why does this occur? Why is this patient presenting this way? And the answer will be because it's due to an incomplete obliteration of a pharyngeal groove. And they'll say groove and they won't say cleft, and you're going to be rattled and you'll put the wrong answer. That's what I did. All right? So make sure you remember, cleft and groove are the same thing. And that's it. That's all you have to know about pharyngeal cleft derivatives. It's pharyngeal cleft cyst. Most important thing. All right? That's it. Moving on to pharyngeal pouch derivatives. All you have to know is the third and fourth. The third creates the inferior parathyroid glands, and it has the thymus. And it's going to hitch a ride, and it's going to go under the fourth pharyngeal pouch, which has the superior parathyroid glands. All right? So remember, the thymus and both inferior parathyroids are part of the third pharyngeal pouch, which is weird because you would say, why isn't it called fourth? Well, it's because later on, after embryology, you're going to actually see the movement of the third pharyngeal pouch going below the fourth pharyngeal pouch. But who cares? That's not important. What's important is that you remember the third pharyngeal pouch has the thymus and the inferior parathyroids, and the fourth pharyngeal pouch has the superior parathyroids. That's it. That's all that matters. And when we have a failure of the third and fourth pouches to form, then you get DeGeorge syndrome, which just means thymic aplasia. All right? So you don't get the thymus. All right, that's it. So we've gotten down to the clefts and grooves and then the pouches. Now last is the pharyngeal arch derivatives. What they care about pharyngeal arches is very small, short, and simple. I'm going to keep it very quick. This is all I knew. This is all I remembered, and I still did well, okay? For first pharyngeal arch, you have to know for all the pharyngeal arches, I should say. You should know all the nerves associated, okay? And then I'll tell you the rest of the stuff that are more specific. So first pharyngeal arch, the nerve that innervates it is cranial nerve V3, okay? V3. And this helps us chew. So any muscles of mastication, any chewing, and the way that I remembered it is the M's. So anything that starts with M is going to be the first pharyngeal arch. Just if you see something that asks you, hey, and it gives you like a word that starts with an M, something that's a part of our anatomy that starts with an M, and they ask you what pharyngeal arch did it come from, if it starts with an M, put first pharyngeal arch, okay? That's the best way to do it. So it's like maxillary process, the mandibular process, all right? It's the best way to do it, I promise. All right, second pharyngeal arch, CN7. Okay, this is going to be like facial expression. This is for smiling. All right, and the way that I remember this is the S's. If you see anything that starts with an S, put second pharyngeal arch. So like stapes, styloid process, lesser horn of the hyoid. Lesser horn of the hyoid is probably the most important one. And then stylohyoid ligament. Okay, but S. Next is third pharyngeal arch. That comes from CN9. Okay. Now for CN9, all you have to know is the greater horn of the hyoid. Okay, that's it. And the stylopharyngeal. Pharyngeus. Okay. So, three things you have to know for third pharyngeal pouch: CN9, stylopharyngeus, and greater horn of the hyoid. Lastly is the fourth and sixth. All you have to know is that it's CN10, cranial nerve 10, and it involves the larynx. That's it. All right, so I'm going to run through this really, really quick so you understand this. First pharyngeal arch is going to be V3. It's going to be muscles of mastication for chewing, and it's the M's. Second pharyngeal arch is going to be CN7, and it's going to be smiling, and it's going to be the S's, specifically lesser horn of the hyoid. Third pharyngeal arch is CN9, it's stylopharyngeus and greater horn of the hyoid. And fourth and sixth pharyngeal arches, they both are cranial nerve 10, and they involve the larynx. Cool. That's it. That's all you have to know about this pharyngeal arches. If you have any questions, let me know, but relatively lower yield on this. I mean, they will ask you questions, but I just give you essentially everything you need to know.